For many men in northern Australia, feeling constantly tired, irritable, or foggy is a daily battle. Could low testosterone be the cause? But what if the treatment for vitality had a surprise? Medically supervised TRT is so effective, it can act as a male contraceptive. For others, the benefits can be life-changing. A return of energy, mental clarity, and improved mood. But accessing these benefits in Northern Australia isn't always straightforward. It involves specific rules, costs, and potential pitfalls. In this video, we'll map out the entire process, from the first doctor's visit to the costs, the real benefits, and the hidden risks. So, where does this process officially begin? It all starts with a medical practitioner. TRT is not an over-the-counter solution. Your first stop is usually a GP, but they often act as a gateway. Many GPs refer you to a specialist, an endocrinologist, who lives hormone health. Getting a diagnosis isn't based on feelings alone, it requires hard data. Doctors need at least 2 morning blood tests showing low testosterone. Beyond blood tests, a specialist will conduct a full physical exam. They are looking to connect your symptoms directly to the low T levels. For men in Darwin, Palmerston, or remote communities, getting to a specialist is a major hurdle. Telehealth provides that vital connection. Once you have a diagnosis, getting the treatment should be simple, right? Not exactly. This is where many men hit a wall. If your blood tests are low and you have symptoms, why might you still be denied subsidized treatment? The answer lies with the PBS, Australia's system for subsidized medicine. Its criteria for TRT are incredibly strict, often requiring levels below 6 mmol/L. This means many men with clear symptoms and clinically low testosterone, say at 9 or 10 mmol/L, fall into a gray area and don't qualify. For those in the gray area, the main alternative is the private route. This involves paying out of pocket for consultations, medication, and testing. The cost can be significant, running from approximately $1,650 to $2,600 per year. This covers the treatment and necessary pathology work. So, whether through PBS or private means, you get treatment. What are the results you can actually expect to see and feel? Benefit 1. Revitalized energy as the constant fatigue begins to lift. Benefit 2. Restored libido and sexual function. Benefit 3. Improved mood. A reduction in irritability, anxiety, and depressive symptoms. Low testosterone is strongly linked to these issues. Benefit 4. Sharper thinking. The brain fog clears, concentration improves. This often means better performance at work. Benefit 5. Physical strength. Increased muscle mass and bone density. This actively reduces the risk of osteoporosis and frailty. The benefits are compelling, but successful therapy is more than just getting a prescription. How can it go wrong? A major risk is outdated medical practice. Some doctors still use old injection schedules, like a large dose every few weeks or even 4 months. This creates a symptom roller coaster, feeling great, then crashing. Modern methods use frequent, smaller doses for stable levels. Another key issue is managing estrogen. The body converts some testosterone to estrogen, and if levels get too high, it causes side effects. This is why TRT is not a set-and-forget treatment. It is a lifelong commitment requiring regular blood tests to keep you in the optimal range. And recall the fertility warning from the start? It's a prime example of why a complete consultation is vital before starting treatment. Combine the strict PBS barriers and high private costs with outdated medical advice, and some men feel forced to seek unregulated sources. But what about the biggest fear? Heart attacks. Modern large-scale studies have largely disproven this link. Properly managed TRT is safe. This is the central truth. Achieving the profound benefits while avoiding risks like the roller coaster depends entirely on expert medical management. So let's bring it all together. What is the reality of testosterone replacement therapy in Northern Australia? The official pathway is rigorous, requiring multiple tests and specialist oversight, with telehealth now bridging the distance for many. Access can be difficult, with strict PBS rules forcing many symptomatic men towards a significant private cost to get the help they need. The benefits to your energy, mind, and body can be transformative, but require avoiding old protocols and managing side effects with ongoing monitoring. Your first step is not the internet or the gym. It's a thorough conversation with a knowledgeable GP. Get tested, get a plan, and reclaim your health.